I am Bill Pearson, Director of Boston Healthcare Fellowship. Welcome to our videocast. With me today are two friends who are both interns, who are both first-year residents in internal medicine at Boston area hospitals, and they've joined us today to talk about their experience with COVID-19. So thank you, Jonathan, and thank you, Jenny, especially. I hear you've been on nights recently, and so thank you for taking a day off to join us today for this conversation. How has the coronavirus changed the experience in the hospital for you guys?
I can take this question first. When the coronavirus epidemic started to hit Boston, I was actually on vacation for the first week, and I was getting all these messages from co-residents about how the hospital had changed all its protocols and how every day the protocols kept seeming to change. There was really no constant kind of policy or protocol. When I arrived to work my first day back from vacation, it was definitely a shock. There are only limited entrances that staff can go into. You get a mask when you enter. You have to log whether you have symptoms or not. And throughout the hospital, especially in the COVID wards, there's a detailed algorithm of how you're supposed to put on protective gear and take off protective gear. All that is really still evolving. So there's kind of this environment of uncertainty, definitely. Even the simplest tasks that you learn to do as a first-year resident become difficult because of all the safety precautions surrounding the COVID kind of epidemic.
Jenny, what have been your observations?
For me, I have been doing night shifts where I cover the patients who are in the hospital overnight. Usually there are two interns or two first-year residents covering all the patients. So within the last week, the policy changed from no first-year residents taking care of COVID to all first-year residents can take care of COVID. So looking at around each night, anywhere from around like 60 to 80 patients I would take care of, around maybe 20 to 30 of them were COVID positive or rule out, so either confirmed or presumed. So it has been a lot of keeping track of like who's who and what's going on. Especially since I sleep during the day, I usually wake up and there's like 80 messages, text messages, and like even more emails that are just like all of these different updates. Going into the wards, everyone's masked up, everyone's, cautiously standing 6 feet apart. There's also just been a general tension, I think, working in the hospital, even among talking with residents and other doctors or talking to nursing. It's just, there's this kind of rising tension that at any point someone could kind of just snap, where like I felt like people had been, including myself, a little bit more like frustrated at things. On more of a patient side, I think the experience is very different as well. For patients, they actually don't see many doctors or nurses because we try to call their patient rooms. We try to get all our information over the phone. And only if necessary would I then put on the gear, go into the room, evaluate the patient, probably from 6 feet away, kind of like shouting at the patient, and then stepping out as quickly as possible. And then for patients, it also means no visitors are allowed. It's very isolating, and they're often just in a room kind of waiting for updates, which happen usually by a phone call.
Mm-hmm. Well, how have you both seen how COVID-19 has changed the mindset of your patients and people that you interact with?
I have a funny story, or several funny stories, where patients are so glad to hear that they don't have COVID, and they'll like tell them your test was negative, and they'll be like so happy, they're so appreciative. But at the same time, you're sad because you realize they still have a significant illness that they're in the hospital for. Like you basically just diagnose them with, I think there was someone who had really bad, like worsening metastatic cancer, and we tested them for COVID, and they were so happy not to have COVID. But it's ironic because they're also very sick. And I feel like I've had multiple experiences where that has happened, where as the provider, I'm taken aback because I'm like, I can see why you're really happy, but at the same time, there's also illness. There's also a significant illness that is happening as well. Then for other people who who have had to call and say that they've been tested positive, there's usually a lot of anxiety, a lot of questions, and it's not the greatest feeling because I don't have a lot of the answers. And oftentimes I just end up listening and trying to just understand where they're coming from. But it's a really difficult conversation, especially one that I'm trying to do over the phone, which is also not ideal. But yeah, and I think for patients, it must be really, really hard. A lot of uncertainty.
Yeah.
And I think what especially makes it very hard is that patients with COVID can become sick very quickly. So when they arrive to the hospital, they might be only using a little bit of oxygen to kind of maintain the breathing. But within a few hours, 6 to 8 hours, they could progress to the point where they need a breathing tube to support the breathing. So in cases like this, it's important to kind of get a good sense of what the patient would like in terms of heroic measures or life-sustaining measures. When those questions get brought up about whether you want a breathing tube, whether you want chest compressions, that, that kind of worsens patients' fear about COVID, especially since they know COVID can be fatal. And when you start asking questions like that, I think that can bring about a lot of worry and fear.
And their families aren't with them either, correct?
Yeah, and in some cases, the family members also have COVID and are also sick, and maybe they're not so sick, maybe they're at home, or maybe they're also in the hospital, but in a separate part of the hospital. Conversations like that definitely become more difficult because these conversations about illness, about maybe dying, about how, updating family members is always better to do in person. Jenny, do you have any thoughts about that?
One of my nights, I actually was called to a room where this patient wasn't doing well. This patient actually was not a COVID patient, so had a separate illness, was in the hospital, but was very elderly and happened to pass away that evening. And going through that process of calling family members, but then denying them of a chance to come in and see their loved one, and also they were trying to do a funeral, but strongly recommending against funerals and most likely cannot hold a public funeral at this time, was very challenging for me to try to just tell them that, and also hear how sad and just, I think, so the situation affects just not only patients with COVID, but just anyone in the hospital, is just that they're kind of left alone in these circumstances, and their loved ones are also very much in pain because of their inability to be there or to kind of advocate or just see their loved ones.
Mm-hmm. Well, it seems like COVID-19 has really disrupted what we think of as the doctor-patient relationship. Distance, things seem more impersonal. It's difficult to have hard conversations already, but especially when you're not able to be with someone, to talk to someone, to be able to touch them, that kind of thing.
Yeah, I definitely agree with that point, Bill. I was actually quarantined for a couple days for a cough and was being ruled out for COVID. And during that experience, I realized personally that isolation, although scientifically, proven to reduce disease or reduce spread, is in itself stigmatizing, even when it's meant not to be stigmatizing, and even when it's done in a neutral way. I think, knowing, I'm a COVID rule out, or I could have coronavirus, and that's why I need to avoid people. I think that is a isolating, and not just physically isolating, but emotionally isolating experience. And I think many patients in the hospital are going through that right now. And it actually reminds me of the Jewish customs where people with various skin diseases like leprosy would have to stay away from the rest of the village, say that they were unclean so that no one would come near them. And I remember my first day on the COVID ward, putting on my protective equipment, which includes a mask, a face shield, gown, and gloves, and going into the room and not knowing whether to shake this person's hand. My first patient, she ended up not having coronavirus, but I thought to myself, should I shake this person's hand? I'm not sure. I ended up not shaking her hand, but I did a physical exam. I listened to her heart, lungs, felt her belly, felt her legs. And I think that experience of having someone interact with you is very important. And as much as we try to minimize the use of protective equipment to try to limit the spread of disease, I think at the end of the day, a physician's touch or someone going in and having an emotional connection, having a physical connection, having that relationship is really important to the patient's kind of emotional status. And I think of Jesus when the man with leprosy came to him and he ended up healing the man with leprosy. He chose to do it by touching the man to make him clean of his disease. And I think as physicians, that's something we need to keep in mind, that social the isolating process can be very stigmatizing, and we need to be there to kind of bridge that distance as much as we can with wisdom, but also with compassion.
Yeah, I think traditionally doctors were called doctors because of the word doctrine. Doctors were to teach people what it means to live well and die well, and that function of a doctor is really fallen out of the normal practice in modern medicine, where we're measuring the mechanism of the human body and keeping different organ systems operative and whatnot, but not really helping the whole person know what it means to really live as humans really well. And I wonder if this would be a good outcome of a post-COVID-19 age, whether that's in the role of the physician or just even a question that people wrestle with as a society. In addition to social distancing and other good practices, are we living the kind of life that we want to live, recognizing our own mortality?
Yeah, and I think the other irony to social distancing is it gives us a lot more time alone to think about these questions. And I've definitely thought more about these questions while I've been having more time alone, and definitely encourage anyone that's listening to do the same. It can be uncomfortable at first, but I think it's an important part of what it means to live a good life, is to figure out how to live a good life and then to do it.
Well, thank you guys for joining this conversation. I appreciate your comments, and we'll continue to pray for you as you serve the Lord, caring for patients. Thanks so much.
Thanks for having us, Bill.
You're welcome.